I provide privacy. Hi, I'm Heather. I'm going to be your nurse today. Can you verify your name and date of birth for me? Alright. And I would ask them if they had any questions throughout the procedure. I would check my orders and my policies and procedures. I would explain NG tube insertion to them. And so first I'm just going to remove the pillow so then they can extend their neck. And then I would ask them if they have a history of nasal surgery or trauma, deviated septum. And then I would look in their nose, looking for polyps or any lesions or anything. And then I would occlude each nostril and ask them which one they breathe better out of, and that would be the one that I would use for the tube. So I would measure the tube from the tip of their nose to their earlobe, and then down to their xiphoid process. Right there. And then I would mark that with a marker. So there, I've got that. So I would just put this down. And I would hand hygiene. Get my gloves on, and I would raise the bed up. It's already raised up. I would move the head up a little bit more to Fowler's or 45-degree angle. Give them their water cup. Let them know that they'll be using that in a little bit. Now I'm just going to lubricate the tubing about 2 to 4 inches at least. And then I would be getting my tape ready. There's none in here, it's all out. But I would have my tape ready so I can secure it afterwards. Alright. So I would just tell them to try and relax, and then to just extend their neck back, and I would insert it in gently. And then once it was about 5 inches in, I would look in the back of their throat to make sure I see the tube. And so then at this point, I would have them put their chin to their chest, and I would give them their water, and I would have them swallow, and I would tell them each time they'll swallow, I'll insert the tube. So I would swallow, swallow, swallow. And if I meet resistance, I would be twisting the tube, not forcing it in. So swallow. There we go. So then I would secure it in place with my tape just loosely. And while I was doing that, I was looking for signs of respiratory distress such as cyanosis, wheezing, coughing, inability to talk or hum. So now I would secure that there. I would remove this. And then to ensure placement, I would have an x-ray done, and then I would also get some gastric content. So I would on there. Get some of that. And then I would put it in my little dish, and then I would test the pH, and I would be looking for it to be between 1 and 5. And then I would also be looking at the color and the consistency of it, and I would measure the length of the tubing from here to here. And then I would secure the placement of the tubing on the nose. I would tape it better. And then I would also get tape and my safety pin here, I would have them look to their left, and I would pin it on their gown just to make sure they have full range of motion on their neck. And then I would hook this up to low intermittent suction set at 80. I would ask them if they need anything else. I would provide mouth care every 2 to 4 hours, make sure their lips are moisturized, give them their call light, lower their bed down, put the side rail up, make sure they're comfortable. And so now it's been a few days. I have orders to remove the tube, so hand hygiene, provide privacy, knock on the door, have them verify their name and date of birth, explain to them that I'm going to be removing the tube, ask them if they have any questions about it. I would also do an abdominal assessment beforehand. So I would put this back down, give them the basin, and then I would raise the head of the bed up again, put my gloves on. Again, I don't know if I said I would verify orders for removal. And then I would disconnect it from the suction. And then to make sure the tubing is clear, I would get about 30 to 50 mils of air. And I would just push that through the tube. And then I would remove all the tape and everything, remove the pin from their gown. And so I would have them take a deep breath in and hold it, and I would tell them that when they do that, I'm just going to take the tube up. So I'm going to clamp the tube first, have them take a deep breath in and hold it. Alright, and then I would dispose of that. I would give them water, give them tissues, provide mouth care. And then I would record the gastric content. Also with insertion, I would have documented the tubing length, the time I inserted it, which nostril I inserted it in, the initial gastric content, the pH of it. And then for removal, I would have documented the time I removed it, the gastric content, the amount, and I would dispose of that in a biohazardous bag. I would document my abdominal assessment, and then I would ask them if they need anything else, make sure they're comfortable, give them their call light, lower the bed down, and that concludes my skill.